And so can you walk through what some of the main treatments are that you do at the practice to help treat those?
Yeah. So regenerative injection therapies is the sort of the main squeeze, if you will. That's the potent healing response. And so that's a category of injections. That's why I say regenerative injection therapies. And I usually like to explain it in terms of different levels of potency. So we start out with sort of the basic therapy that's been around for decades called prolotherapy. So we're using a dextrose sugar-based inflammatory solution along with a short-term anesthetic just to help you get through the actual injections themselves. It's not designed to have long-term anesthetic properties. So that's our baseline. Then I sometimes incorporate ozone and do prolozone. Then we'll utilize platelet-rich plasma. That's where we extract blood from our patients and actually concentrate it into the growth factors from their blood and inject that at the site of irritation, trauma, pain, damage. And then the most potent category, I like to call medicinal signaling cell. This is the category that has the most controversy around it. Stem cell is when we actually harvest the stem cells from a patient. So it's called autologous stem cell, where it's done from either extracting those from the patient's fat or bone marrow. I don't like to use that because I find that stem cells age along with my patients, and I really like to have the most vital growth factors. So I'll actually recommend medicinal signaling cell, not calling it stem cell, just from an FDA perspective, but it's derived from donor tissues and or exosomes. So that is the most potent within the regenerative injection categories because it's actually delivering potent growth factors and from where I prefer sourcing it from neonatal tissues, so very vital growth factors. And then there's pros and cons as to whether or not we actually get cellular material versus exosomes. I think nowadays I'm in favor of using exosomes because then we don't have any issues with any DNA contamination or infections because it's the signaling molecules that cells give off. It's not actually cells themselves. So I utilize all of those different options in my practice because it really comes down to, for each person, what is the best injection. Prolotherapy is the lesser expensive, but has to be done more often. So I'll typically do 4 to 6 treatments, and they each need to be spaced out a minimum of 4 to 6 weeks because we do the initial injection and it takes about 5 days for the major inflammatory response to conclude. And then it takes about 21 plus days for the tissue remodeling phase. And like I said earlier, with these regenerative injection therapies, we're not trying to inject a solution that masks the pain. We're trying to create micro trauma to activate the patient's own immune system and ability to heal that area. So we have to give it time. So for prolotherapy, it's best for mild to moderate chronic issues like a mild tendonitis or a mild ankle sprain, things like that. I don't typically utilize it if there's advanced arthritis or, a herniated disc or a partial ligament tear. I'll go to some of the higher levels of regenerative injection therapies, PRP, but that one's going to depend really on the patient's age and health status because that's grafting growth factors directly from my patient. And I do have some patients that are in their 20s. I've had baseball players and basketball players, tennis players, water polo players, usually athletes that have sustained injuries. Fantastic using PRP or something that doesn't have any donor-derived growth factors because they're young, vital, usually have great hormones. A lot of their body is primed to heal. But for those that are, 50s, 60s, 70s plus, I don't typically recommend PRP or using growth factors derived from their body because hormones not going to be awesome, accumulated stress, toxicity, dysfunction. And so when we're doing an intervention like a regenerative injection therapy, we want the best possible outcome. And so we have to set up the best possible scenario from the beginning.